So it's very interesting. Patients in general think ureteral stents are a horrible thing. A ureteral stent is a plastic tube which helps drain the kidney. So you can see here there's one end of the plastic tube sits in the kidney, the other sits in the bladder, and it allows for urine to go from the kidney to the bladder without any interruption. So why is this important? Well, let's talk about why a kidney stone hurts. A kidney stone hurts because there's something called hydronephrosis, or swelling in the kidney and the ureter because urine isn't flowing out of it. Here you see a graphic where on the right side there is normal flow of urine and the ureter is normal. On the other side it's stretched or distended, and this hurts quite a great deal. There can be a number of reasons that you would have a blockage of the ureter causing this, but the most common would be a stone. One of the most common ways that stones are removed is something called ureteroscopy, where a scope is passed into the ureter. We use a laser to break the stone and the pieces are removed. One of the unfortunate things about this, though, is that the process of going in and out with the scope can irritate the ureter. If you look here in this picture below from ureteroscopy, the lining of the ureter appears red and inflamed. Why is this important? Well, that inflamed tissue can swell. The swelling can actually block the flow of urine coming from the kidney to the bladder, stretching the kidney, causing pain that feels really bad and feels just like a kidney stone. So a few months ago, I had a patient that I did a stone procedure on, and in fact, all of the stone fragments were gone, but they came into the emergency department with pain just like they were having a kidney stone. And it was because there was hydronephrosis, or swelling of the kidney, that was blocking the flow of urine. I had not left a stent in this particular patient for a number of reasons, and one of them was their own request. There's no doubt that ureteral stents can be uncomfortable and cause a number of symptoms, but a stent serves a purpose. If we know the ureter is going to swell and block the flow of urine, it would be better to have a stent in place for 3 days to up to 2 weeks afterwards to avoid trips to the emergency department and need for a lot of pain medication. So once again, a stent is not a free lunch, but it serves the purpose of keeping the ureter open after endoscopic stone procedures and keeping patients out of the emergency room.